Hi class, welcome again to another session on rehabilitation engineering. So there's a small topic related to mobilization exercises which I thought I'd discuss in this video, and that is grades of motion. So it refers to the amplitude of movement and the range in which the movement is performed, right? So grades of you have certain gradation based on the amplitude of the movement and the range of the movement. So the commonly used grading system are the Maitland grading system and the Cyriax grading system. So the Maitland system it considers treatment of pain and stiffness due to mechanical reasons by applying oscillatory movement to the vertebral joint. Now, these are graded based on their amplitude into grade 1 to grade 5, right? So, grade 1 is small amplitude movement performed at the beginning of the range within the resistance free part of the range. Now, grade 2 is large amplitude movement performed at the beginning of the range within the resistance free part of the range. So, you are not applying any resistance at all, and then you are performing small movement or large amplitude movement. So, if it is a small movement without any resistances within the whatever range of movement available, so within that movement, if you are performing a small amplitude movement, or if you are making the your patient to perform a small amplitude movement without applying any resistance, then that is grade 1 according to Maitland system. Now, large amplitude movement on at the beginning of the range without any resistance is grade 2. Grade 3 is a large amplitude movement performed into resistance or up to a limit of a resistance, right? So, grade 4 is small amplitude movement performed into resistance or up to the limit of resistance. So, you are applying some resistance. So, it is either till the resistance or either till like for example you have your arm fixed at a certain position, and you are moving the patient's joint till your fixed arm. Then your fixed arm is the resistance. So either whatever limit it is there, like for example you are doing adduction or you know mm, not adduction, abduction of the hand, like so your shoulder suppose. So your arm, you're setting the limit such that the arm is stretched such that it is horizontally parallel to the ground. So that is your limit, and you are putting your hand at that particular limit, and you are moving the patient's arm till the hand is horizontal, till the arm is parallel to the ground. So the point at which the patient's arm hits your stationary arm is the resistance limit. So, applying small amplitude or large amplitude till that particular resistance limit ends up being grade 3 or grade 4 on your Maitland system, right? Grade 5 is high velocity, short amplitude thrust often near or at the limit of the abnormal movement, right? It's a speed outside the patient's control. Okay, so these are like small it's like doing cardio, to be honest. Suddenly you're doing something that is very very fast. Just that when you are doing your cardio at your will, you are able to control it. Here the patient wouldn't have any control, right? It is the therapist would rapidly move the arm at a very high velocity at small amplitude, and the patient wouldn't be able to control it. So it is in our hands to make sure that we do not cause any injury to the patient. Now, the Cyriax method relies on the concept of referred pain and consists of massaging the soft tissues to alleviate the referred pain. Now, often when you have, you know, especially if you have cervical spine problem, like cervical vertebra, if there is a vertebral compression or if it is cervical spondylosis, then any trauma to the neck area would result in pain on the upper back. you know you'd experience the pain in the middle of your back, but you wouldn't be able to exactly figure out where the pain is, right? It's like, if you have a sprain, you can exactly point what the area where it is very very painful, and you can massage it. But here, when it is the case of referred pain, you'll feel the pain in the middle of the back. However, the problem is not in the middle of the back. If you know your if your neck is nicely massaged and your shoulder blades are massaged, then the pain in the middle of the back, it gets relieved, because that's a rapid pain. You're feeling the pain there, but the problem is not at that particular point. The problem is elsewhere. So Cyriac's method actually identifies what is the root cause of a referred pain. Suppose you're having a pain in the middle of the back, right? So the root cause is your neck. So they will concentrate on massaging your neck and make sure that the neck muscles are nicely loosened up. So that would relieve the pain in the middle of your back. I hope you had a fruitful session learning about grades of motion with me. I hope to see you again in another video soon. Till then, take care.